everyone, and welcome to today's webinar, Healthcare Technology Executive Perspectives, Digital Transformation Secured. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. You can submit any questions you have throughout the session by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. And if at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to introduce today's moderator, Troy Ammond, Field Chief Information Security Officer at Fortinet. Troy brings more than 20 years of experience to Fortinet, transforming information technology and security programs, with 14 years in the healthcare sector as an executive overseeing clinical technology implementations and serving as the Chief Information Security Officer at two of the largest integrated health delivery systems in the US. Thank you so much for being here today, Troy. I'll now turn the floor over to you to introduce our panelists and moderate today's webinar.
We're excited to join the panel. We have just a super group of professionals leading the industry today. So the first person I'd like to introduce is Deb Moreau. She is the Chief Information Officer at El Camino Hospital. Deb has transformed and improved the consumer and patient experience through innovation and partnerships in the Silicon Valley. With more than 25 years of combined nursing, clinical, healthcare, and technology experience, Deb has held various positions within healthcare, IT leadership, focused on the delivery and realization of optimal technology solutions and best practices. Thanks for joining us, Deb.
Thank you for having me.
Also with us is Chris Friends. He's the Assistant Vice President of IT Security at Mount Sinai. Prior to his time at Mount Sinai, he served as the AVP of Information Security at Interfaith Medical Center. Under his leadership, the hospital system was the first in the country to embrace the zero trust model for network security. Thanks for joining us, Chris.
Thank you. Happy to be here.
Great. And finally, we have Ben Smith. He's the Vice President and Chief Information Security Officer with Nuvance Health. Ben is committed to protecting the information that is entrusted to Nuvance by the communities the health system serves. In support of Nuvance's goals, Ben oversees the information security and IT risk management vision, strategy, delivery, and operations for the health system. Thanks for joining us, Ben.
Thanks for having me.
Well, great. We are super excited to talk about healthcare technology executive perspectives, and we have, just a numerous number of topics. So we'll just jump right into it. And first, Deb, the first topic that we want to talk about is really the global pandemic has challenged the healthcare organizations in many aspects. The overwhelming consensus is that technology and digital transformation has been responsible for solving many challenges. Can you share your organization's journey from a pandemic response perspective?
Absolutely. As we encountered the pandemic, we've never experienced this before. And so, the initial response was just really, how do we keep running the business? And the business of our company, obviously, is taking care of patients. And so we, really enacted a more stringent daily huddle where we were really addressing items as a team and being very flexible and nimble. The first thing that we had to deal with was, can we take care of patients throughout the house? And so we had to determine that we could take care of critical patients in other places. We had to make sure we had supplies and PPE and all of those things. So it was really, all about running the business. And then we started thinking about, now that we can run the business and so couldn't or didn't want to drive to our facilities. So how could we take care of patients remotely? And so obviously virtual visits, which I know we're going to delve into in a moment, but really taking care of and meeting the immediate needs of the patients. After we sort of got solid on that, and then helping individuals work from home, so our employees as well, really making sure that we could securely and effectively allow our employees to work in remote locations. After we settled all of that in, then starting to think about, now, how do we innovate during a pandemic? And as we stopped having visitors allowed into our buildings, we had to think about, how do patients connect with their family? We had patients in very difficult situations, And can you imagine being a patient that's very ill and not having, your family around you? And so we had already implemented iPads in patient rooms so that patients could access their medical record. We started using those iPads so patients could then interact with their family members. And that was really important. So innovation then we took over with innovation, which was really great. We implemented a media platform in the patient room, even during the pandemic, where patients, in addition to entertainment, could see on the screen any changes in their care if their doctor had ordered a new medication or a therapy. And so we really started to take the pandemic and build around that. We're now dealing with how do we then move our care out into the community. And so we're not waiting for individuals to come to us for care. We're now reaching out. So we established pop-up clinics for testing. And as you can imagine, trying to do a pop-up clinic with no technology really was a challenge because we just had to do it on a sidewalk, in a building, like a city hall, in a school. So, the team got very involved with that piece of how can we be more nimble and effective, even reaching out into the community. And now we're doing mass vaccination clinics. We just took over a high-tech building in the Silicon Valley. We'd outfitted it with our technology, and we are now serving the community with vaccinations. So I think it's really gone from survival, running the business, to innovation, and now reaching out to the community.
Thanks, Deb. That's, I think, such a great summary of the different phases that health systems really experience. Maybe hand it over to Ben. Ben, maybe would you like to add or reinforce anything there that nuance that you experience?
Yeah, I think Deb hit on the agility piece, which was huge for us. The health system spans, really the entire western side of the state of Connecticut, right along the border there, and then same thing on the eastern side of the state of New York. So, from a geographic area, we were running all over the place. We had already had multiple digital programs spun up. And then, of course, COVID, when it hit, accelerated a whole lot of those things, especially telehealth. And that took our CTO, CMIO, and others to really start to focus and drive technology development and delivery into the practices and out in the community, which, as especially during the initial wave of COVID, left everybody kind of wondering, okay, how are we going to handle the increase of patients? How are we going to, if we need to get to it, do we develop field hospitals and those sorts of things? So that left us in, a difficult position of, who takes some of that sort of stuff. And, I, as the CISO, ended up running some of those field hospital deliveries, right? So you kind of pick up where you can, and, you don't set your flag and say, oh, all I do is security, or all I do is app development. You have to be agile, and you have to be able to flex with what you need, or what the organization, what your community needs.
Yeah, that's great. I pick up on something you said there, where this was really an all hands on deck, no matter what your role was. Within my security teams, we had a lot of staff that had really great incident response and emergency management experience, not in the perspective that, they would handle a pandemic. That was never anything that they were trained for, but it was really for an emergency, more of a cyber emergency, but really transitioning that and helping out building the command centers. So Chris, what else would you like to add on this topic?
I would definitely highlight some of the things I already mentioned, the agility being a big one, because actually being a New York-based hospital, we were hit very early on in the pandemic in a very hard way. So the ability to really be agile is what really helped get things through. It was the ability to roll out telehealth, roll out remote access, add medical devices, all kinds of other devices to the network, kind of reorganize parts of the hospital to handle various types of patients. That was all very, very critical. And in my experience, the hospitals that actually invested in technology the most were actually able to be the most agile. So in a lot of ways, it was kind of very empowering for the IT and the IT security departments, because it really showed that they were a critical business function, and that the better resourced those departments were, the actual better the hospital was to actually adapt to the situation and come out ahead.
Yeah, absolutely. Great. great perspective there. Maybe jumping into a little bit more specificity, but Ben, talking about workforce mobilization, it's really been a cross-industry challenge, not only within healthcare, but certainly in addition to responding to the pandemic, and mobilizing our workforces. So a lot of folks are ensuring a great user experience while maintaining the ability to monitor and protect corporate assets is really important. So what lessons learned and successes did you experience that you would encourage other organizations to consider for the future, and what do you envision is here to stay for the long term?
Yeah. So I think you're absolutely right. I think we all on this call, whether you're participating or you're on this panel, have dealt with remote access in some form or fashion. And I think, like most everything else with COVID and technology, it just accelerated the need for it immensely in a very short amount of time. I think we went from right around a 5%, maybe even a little bit lower than that, workforce that was either 50 to 100% remote, to north of 35%, even into the 40 and 50% at max ranges. So obviously, you're trying to scale your technologies. You're trying to figure out what the best way to do it is. But we kind of we started with a risk management approach, understanding what do our team members need access to. Is it just email? Is it email and file shares? Do they have on-prem apps that they need to access when they're not on-prem? Cloud services that we deliver or support delivery for? And then where are they accessing that information from? And once you figure out those sorts of things, you also need to figure out how do you deliver those services currently. We have a mix of VPN, Citrix-based app delivery, direct cloud access. We push out managed devices, so laptops, terminals, those sorts of things. But we also, have a significant amount of BYOD that attaches to our network in some form or fashion. So all of these sorts of, all these parameters kind of roll into, what the risk posture is for each type of user that we're working with. And then what we tried to do, and I think we were largely successful, but we were able to, kind of group those folks into kind of a 5-category layout where, depending upon the category you're in, you are assigned a different risk level, and you are either provided different types of hardware or given different types of access. I don't think I'm saying anything that's terribly revolutionary here, right? This is, really any organization that's, especially those that are outside of healthcare that do a lot, talk about like sales organizations or technology organizations like Fortinet with a large sales force, you're thinking through those sorts of accesses a lot more than maybe we in healthcare are, because, most of our team members need to be on-prem to be able to serve the patients that we do. So, we go through those tierings. Quite honestly, we took a lot of time to talk about the technology mix that we had, whether it's, the hardware that we're pushing out, or the bandwidth. Bandwidth became a really interesting conversation for us. Thankfully, we were in a position where we already were right-sized for, the uses that we had, but we ended up putting in 10 gig because, we had the opportunity now too, and it would push us forward into the future. And then the other things that we've talked about, obviously, we're on a security call, so we talked a lot about security and what do we do to make sure that we're providing, the best access for our team members as they move off, but also provide the most visibility that we can get to what they're doing when they're coming in or when they're going out, and how do we stop bad things from happening. We've looked at quite a number of technologies. We talked about VPN already, obviously being in there, but the secure web gateway is also a big thing. I've always been a huge proponent of that, mainly especially in a hybrid or cloud sort of delivery model, because it gives you that visibility no matter where somebody's at from their laptops when they're off-prem and what they're doing. CASB is another big thing as we've moved to the cloud, and cloud file storage, et cetera, has also been a boon for us as we started to deliver some of that. And then when you start to talk about the devices that you're pushing out there, encryption, whole disk encryption across your environment, saves you a boatload of problems if something is disappeared for one reason or another. But then the question actually really boils down to is, why do you need that file storage off-prem anyways, right? Can the person that is doing the work, can they do that work without storing something to a local device? Can we utilize a terminal system instead of that, full boat laptop or desktop, sending that out to the home? So I think those are a lot of the things that we thought about. Obviously, policy and procedure and working closely with your HR, legal, compliance departments as you kind of spin that out, not only from a management perspective and employee management perspective, but also, a technology perspective. Do you need to make changes to your acceptable use policies? Were those sorts of things covered prior to, moving a lot of your team members out into the field or work from home? And quite honestly, I don't see any of this going away. I think there's going to be a shift, at least partially back into the office. And I think it'll be different for every organization. I'm sure it'll be different for each one of us that are on this panel and how each one of our organizations decide to handle it. But it's not going to be, that 50%, I don't think, that I'm seeing at a max. I wouldn't be surprised if it settles at 30, 20, somewhere between 20 and 35% long term. So it's something that we're always going to have to think about and always going to have to manage going forward.
Yeah, I think going back to your comment about moving from 5 to 10% to 40 to 60%, depending upon the organization, that was such a huge shift and a tribute to our technology teams that made all of that happen, right? And then adding on there, making sure that we didn't create any major blind spots for security teams to keep the organization protected. But Deb, maybe going over to you, I'm sure this was a challenge for your organization as well.
It is, and we were highly virtualized, so it was an easier move for us. But obviously, the individuals that want to do harm to us want to, really realize that we were all distracted, and so we were on heightened alert of how do we make sure that we're putting all the protections in place. And of course, during all of this, we received the notification that healthcare was being attacked in the late fall. So a lot of attention on security. One of the things that we focused on as well is awareness training for our staff with the phishing concerns. In addition to remote work, we wanted to make sure we armed our employees. And so we've enabled some technology to help us obviously monitor the emails that are coming in, as well as creating awareness. And it's been exciting. We're starting to do a sort of a rewards program that if someone identifies a phishing email, we really make a big deal about it and reward people versus making it a punitive, you have to go to training type of an event. So that's been exciting in the midst of a pandemic.
Absolutely. And Chris, maybe add some perspective from Mount Sinai.
Sure. To not parrot back what was already said, because I agree with all that, I'll kind of add some additional context. One of the problems that many hospitals face is that they had to roll out this technology very quickly. So that allowed a lot of hospitals to roll it out without going through the normal risk processes, putting normal controls in place. But one of the things I found very different is ahead of time, because we had done the Zero Trust initiative, we had spent a lot of time ahead of time figuring out exactly what resources each person, each device in the organization needs to access. And one of the things is because we had all these Zero Trust policies in place and a heavily virtualized environment, we were actually able to take that and actually scale with that kind of security in place. So one of the really interesting things to discover as part of going through all this is a lot of the legwork we had done as part of our Zero Trust initiative had really actually helped us to scale, to grow to meet the COVID challenges without having to compromise security. So that was one of the very, very interesting things to see. And one of the things I would actually encourage a lot of other organizations to do is actually take the time and sit down and actually take a complete asset inventory, begin to map out how those different assets talk to each other. And the better you understand how your network actually works, the better you're going to be able to introduce new technologies like this and introduce them securely. So that was one of the really, really interesting things to see, was that we could actually take the security model we had built and actually scale our architecture to deal with the growing demand for remote work.
Great. And maybe Ben or Chris, heading right into this next question. So healthcare organizations have been implementing virtual visit technologies. I think in my career for the about the past 10 years, right? And this has been something for me that's been really, really refreshing to see. But the pandemic accelerated the adoption among physicians and patients, right? How do you see this evolving into the future?
I definitely see it continuing to evolve. In my experience, in talking to both patients and physicians who use the services, both are very happy with the experience. It's something that most people like. I see it as a benefit because it does provide increased access to care. So I really don't see these technologies going away. And as you mentioned, I think these things were a long time in coming. COVID just worked to accelerate it and get it out the door a lot faster for a lot of hospitals. So I think hospitals and really need to think about how they're going to continue to roll out these technologies, ways it could potentially expand as you see more and more wearable technologies acting as software-based medical devices and other stuff. I think you're going to see increased expansion of telehealth technologies. So I think that's a trend that's here to stay and will actually grow, not actually decrease. Alongside that too, though, I think some of the interesting stuff is some of the security challenges that telehealth being rolled out so quickly poses for a lot of organizations. Like, for example, one of the considerations is that HIPAA was temporarily suspended for a lot of telehealth. So you could use things like FaceTime and other stuff to actually implement telehealth technologies. And that made it really interesting for a lot of hospitals to roll these technologies out. But it's often going to be a big challenge for a lot of hospitals to roll that kind of stuff back in if they allowed it to go in place, because things like HIPAA won't remain suspended forever. So I think there's a lot of work for a lot of organizations to do to ensure the technologies they're promoting and rolling out, are HIPAA compliant or long-term compliant with the security and risk profiles of the organization. But I do think it's the technology that's here to stay and something that organizations should start putting on their roadmap.
Great. Just to share a little experience that I had with a couple of the organizations I worked with, we were, had big campaigns and big, digital strategies of turning on and enabling virtual visit technologies and all of that work, and all of that training of physicians. We were still only doing about 60 to 10 virtual visits per month pre-pandemic, going back to January and February of 2000. And now those same organizations that I've stayed in touch with are doing 45,000 virtual visits per month. And I think that's plateaued between 20 and 30,000 now today since the pandemic. But Ben, I'm interested with your organization. How are you seeing that today and moving forward and advancing?
Well, I mean, as part of our larger digital delivery program, we're actually re-implementing a new telehealth product. But overall, when we started, I think we were doing somewhere right around 5 visits a week,
right.
And now we do 3,500 to 4,000 a day. So that exponential increase is there, and quite honestly, we expect to keep it somewhere around that, maybe a little bit shy of that, maybe down to like 3,200 a day. But the expectation is that we are doing a very large amount of our visits virtually, and quite honestly, what we've seen in the marketplace in the last couple of weeks, with Amazon making announcements around virtual visits, as well as others, if we're not doing that well, it's going to be hard for us to continue to keep pace with the marketplace. So I don't see it going away. I see it, staying at pretty much where it's at, and if not getting stronger, especially for those primary care, quote unquote easy to take care of sort of visits. From there, then you start to look at how do you most effectively transition someone from that virtual visit into a live patient visit, and that's another conversation as you're going down your digital journey.
Yeah, I would agree. And I think I see a lot of different organizations either staying with the platform they have and expanding it, or making a decision to move in a different direction with the new platform. The other thing that I see in the marketplace is adding more connected medical devices. One example of that is home kits that patients can have to take temperature and get different types of vitals and that type of thing, to be a part of that interactive patient experience and create more of a consumerized retail approach, right? And I think everyone in the space is going to need to compete with that. But Deb, being there in Silicon Valley, what would you like to add here?
Well, I think it's really interesting. It's the comment's been made several times that those hospitals or those healthcare systems or those organizations that had innovation in their DNA really survived the pandemic well or did well. And I find that is so true. Virtual visits was one of the areas where in the fall before the pandemic, I was really struggling to get the C-suite on board with buying a telehealth product because, the adoption rate was so low. And then, of course, the pandemic hit and I was asked to have virtual visits ready by tomorrow. And luckily, I had already selected a vendor and we were on our way. I think we, as many organizations, went with the easiest product with the HIPAA, regulation reducing. And there's some security, obviously, issues with some of the products that many of us have been using. We've moved to a different product, trying to move to a different product that integrates with our EMR. But there has been some challenges with, as you imagine, a doctor trying to make they're not always wanting to deal with technology. The patient definitely has different types of devices and it has to work. Mm-hmm. And I think, we're in the midst of trying to get a product to work well, high reliability. And so that's, I think, something that's going to be in our future is secure, integrate with your products like an EMR, but have it easy to use. And how does that workflow work? We're also doing telestroke and some other capabilities due to individuals working more remotely. And then, of course, as was mentioned, hospital in the home is a really initiative that we're all going to be focused with of how do you do remote patient monitoring? Because during the surge, we had a moment in time where patients could go home, but they still needed to be monitored, and they were taking a bed that we needed for other critically ill patients. And we really realized we needed to have that capability. So we're working on that now to be ready for the next major event that might come our way.
Yeah, that's great. And, I think no matter where a health system was at in their journeys, I know that my former organizations, we had trained physicians and that type of thing, but we really had to, almost even from an implementation perspective, because the training component was so important and the technology component was so important, is really re-implement, retrain all of our physicians, remarket that service, and then retest and improve upon that integration. So it's definitely a challenge, no matter where we're at. But maybe jumping into the next topic. So clinical data analytics has been core to solving many challenges, such as supporting supply chains, testing, vaccine distribution, administration, and managing resources. Can you talk a little bit about how your organizations leverage data science and analytics? And we'll start with Deb.
We spent a lot of focus on this pre-pandemic. We had actually enabled enterprise web-based dashboards that our CEO, COO could all from their desktop see the vital information to run the business. And so we were already on that path, and then the pandemic hit. And we started working with our core vendors every day to make sure that we had the latest upgrades from their products. And we were enabling COVID dashboards and the ability to do, be able to take care of patients real time, manage PPE, manage, and we never got to, but what I would love is to get to a forecasting of events. So that how do you know next week what your pandemic volumes could be? I think that's the future for us, is to really think about how to be predictive and not reactive. And even not today's data is too late. We need to know what tomorrow's data is going to be. We have implemented some things like a deterioration index, which takes data from our patients and it alerts us to a patient that's not doing well, and it sends a rapid response team to the room to prevent a bad event. So we're building on that, but we have a lot more to do in that space to take the systems and the products and the data that we have to make it really meaningful and predictive for our organization.
Yeah, that's super. I think the predictive part that you talked about, it could be so important and valuable, right? Because seeing where we're at here and today, what we're really trying to establish is, where are we going to be? And I think that's really great. So Chris, maybe if you could add onto that as well.
Sure, I definitely agree with the value of predictive clinical analytics. I think that's a great way to go. I think that is largely the way a lot of hospitals are going to go, and it's one of the features of improving patient care. I think it ties in very nicely with a lot of evidence-based medicine initiatives and other factors like that. With that being said, one of the things that I will say is I do come from a machine learning background. Before I started in security, I got my start in healthcare doing machine learning algorithms for designing pharmaceuticals. So one of the things I will caution with any organization going down that road is you have to pay really good attention to the quality of the data you're feeding into those models, because how good that model actually turns out to be is really dependent on how good the data set you use to train the model is. So for any organization considering going down that road, make sure you establish a very robust set of training data in order to train those models before you begin to make predictions on it. But I do think there is a ton of value there. And I do think it's going to be a great way to improve patient care and patient outcomes.
Yeah, absolutely. When we talk about predictive modeling, one of the challenges that I've seen is a lot of health systems were trying to predict, whenever their surge was, right? Because everyone's surges came at a different time. I think for some of us on the East Coast, it came a little bit earlier. And then for some on the different coasts came a little bit later. But what was interesting about that from my experience is we were scaling up our beds. So we had 3,400 staffed beds with a planning for the surge, which for us happened last spring, of going to 5,200. And we built out all of that infrastructure, built out all of those beds. And then fortunately, what happened is our numbers significantly decreased due to different measures that were taken and better education to patients around, whether that was, social distancing or lockdowns, that type of thing. So it was a really good thing, but it would have been very powerful to have that, prescriptive or to be able to see that into the future if we really needed to do that. Ben, what else would you like to add there?
I think one of the things Chris said earlier about, organizations making quick decisions and not having not necessarily taking the normal risk precautions or risk evaluations that they might have previous to the pandemic certainly applies here. As a lot of us stood up more predictive analytics, more tool sets. We started to create multiple secondary databases of our patient information and started to put them in different places, whether they were on-prem or with a third-party vendor. So, as we start to wind down and get our feet underneath us again, it's going to be worthwhile to kind of roll back to some of those decisions that were made to make to at least get an understanding of what your new risk posture looks like, and making sure that you didn't get into bed with a company that is now selling your information or doing something or not protecting it as well as you might expect it to be.
Yeah, great point. And I think just the last things that I would add on there was really sharing that data, not only within your own organization, so that as you're shifting patients or supplies, PPE around between different facilities, but the value that I saw from that was sharing that outside of the organization, right? Because in a big pandemic, it's not only what you need to be doing internally to your organization, but making sure that if you need to transfer patients to another facility or transfer ventilators from one facility to another, even though it's a difficult thing to do, between organizations, sharing that data and making sure it isn't siloed. So let's maybe shift gears a little bit and talk about the threat landscape. So the threat landscape, Ben, has expanded due to digital transformation and the threat actors taking advantage of the chaos, right? We saw that so much. So that's really increased the volume and the impact of ransomware attacks as we got later into the 2020, into the pandemic. So what's your experience been protecting your patient data against these evolving threats in the past year?
Yeah. I think, I don't know, I don't disagree with anything you just said. I think some of it is, we've increased the volume. We haven't increased the differentiation maybe of the attacks, right? We were seeing ransomware previous to the pandemic. We were seeing attacks previous to the pandemic. So quite honestly, it's a conversation that I continuously have with my executive team and my board, is that, we're all of a sudden seeing this mushroom cloud of it happening. But by and large, this sort of stuff was happening before, but it wasn't getting the press coverage, especially towards the end of last year when we had the supposed directed attack against healthcare. But I'm going to give you a really boring answer. Protection is defense in depth. Making sure that you have the right technologies in the right place to be able to fail over, if you will, if your first protection doesn't work, you've got something else to follow up behind it. To have the visibility in place to see that those protections are failing for one reason or another, and being able to react to it via a SOC or whatever mechanisms that you put into place. But how do you get there? Understanding where your crown jewels are. Being able to do that, that environmental review, determine where all your data sets are, who your most important users are, who are the users that will get you in the most trouble if they're breached in some form or fashion. Where does that data live? Is it on-prem? Is it off-prem? As you spin up new analytics vendors, are they taking your, how much of your data is going to them? How much of it is staying here? How are those solutions interacting with that data? And then how are people accessing the output of that digital transformation, right? Are we standing up new websites? Who owns the website? Does your marketing team manage it? Does your IT team manage it? Do you have a third party that does it for you? So going through all of these things and kind of reviewing, what are the risk parameters of each is incredibly important for you to be able to get to the decision-making process of how do we protect it. What is the level, right? We can protect it by pulling the plug on it and saying, no, we can't do that. Or we can start to work with the business and understand what's important to them. How are they going to be successful in what they need to do? And, what is the organization's risk appetite for allowing those sorts of things to happen? In the end, for me, I want to make sure we've got the access controls in place, and most importantly, no matter what, is the visibility to the transactions that are happening across the network, whether it's new, old, or what have you. I want to be able to see what's going on there and allow my security tool sets that we've made a significant amount of investment in, not just buying, but also getting it set up, implemented properly, tuned correctly, all those sorts of things. To allow those things to work, to tell us what we need to be looking at, and where I can focus my SOC to do the best work.
I like one thing that you said there is some of the things protecting against ransomware may seem boring, but it's honestly the boring blocking and tackling fundamental process and procedures that really prevent against these things. So maybe Chris, if you would like to add on there as well.
Sure, I definitely agree with everything that was said. I would add one thing in terms of the attacks, and I agree they're the same kind of attacks we've always seen, just in bigger numbers. But I think one thing that was slightly different was the amount of fear. I think that made some of the phishing and other attacks slightly more effective because people really wanted that PPE. They really want the vaccine now, things like that. So I think that kind of worked to the edge of the attackers a little bit more than under other circumstances. But with that being said, I'm also very big on constantly testing security. Being that I'm a former scientist, I'm very big on measuring stuff, taking a more evidence-based approach to security as well. So one of the things I've always been big on is I've actually done ransomware simulations within my organization. So one of the things that we did was we actually took the ICAR test string, which for anybody unfamiliar with it, it's a harmless string of characters, but years ago, all the AV makers got together and agreed to treat it as a virus. So one of the things we did is we actually wrote a script and actually used that to try to spread this ICAR test string to all the endpoints within our organization to basically see what malware spreading through the organization would look like, how effective it would be or not be. And one of the things we really learned was that network segmentation was a really, really effective control. And that's kind of what got us going down the zero trust path. It allowed us to segment the network as fine-grained as possible and keep attacks and other threats like that contained. So one of the approaches like I would constantly recommend is to actually go ahead and actually simulate some of the threats that you're going to face. See how well your controls actually hold up or don't hold up. Because it's amazing how you'll find, let's say a misconfiguration, a firewall or something else that you thought you were protected, but when you actually go to test it, that turns out not to be the case. So simulating and testing stuff like that is a great exercise. And it's also great for showing you how the people respond too. So by doing that exercise, we not only learned how people respond, but we learned how employees of the organization respond. So one of the things is we did this back in 2015 at Interfaith. And one of the things we noticed was that we had all these AV prompts going off on all these PCs, and not one doctor or nurse actually bothered to pick up the phone and call IT. So that kind of illustrated the need for more security awareness training among the general population in the hospital and among clinicians in particular. So doing exercise like that turned out to be a really great way to prepare for attacks like that. And I think the more often that organizations do tabletops, do simulations like that, the better prepared they're going to be when actual incident actually comes.
Yeah, I would agree. And one example that I have was, the too good to be true scenario. And that's something that I really preach to everyone within the organization. But, during the pandemic, ventilators were something everyone was challenged to get. And fortunately, we received some really good threat data about social engineering and really focused on supply chains. And those too good to be true scenarios where there was 20 or 30 ventilators for sale at a really good price. And I think getting that data in front of our business folks that are making business decisions, making purchases, can be so important. And Deb, what would you like to add on this portion?
I agree with all the comments on all the tools and technology and optimizing those, and really rehearsing and your recovery methodologies. I would just build on it. I think the most important thing we can have is a savvy workforce, workforce that knows threats and can alert us, as others have mentioned, to those threats is so critical. So I think spending time on that. Another area is just making sure you don't have shadow IT. You don't have pockets that aren't as carefully managed as normal. It's really important. And I think the biggest piece is, in addition to IT and info security, doing a lot of practicing on recovery, we really need to make sure the business is doing business continuity procedures, because in the reality, that's so important, is that individuals within the organization know what they would do, so that they can still take care of the mission of the organization during that recovery period.
Thank you. So kind of wrapping us up today, the last topic we wanted to take a look at, Kristen, we'll start with you. When looking at the pandemic and really heroic actions that were supported by digital transformation, what final lessons learned do you think will drive future strategies and initiatives into the future?
I think the big thing for IT and InfoSec was that it really showed the value of investment in digital technologies. I think the organizations that had the best investment in IT technologies were the best able to adapt. So I think it really demonstrated that the hospitals that put proper resources into those kind of infrastructure were really able to change, to roll out telehealth quickly, to roll it out securely, same thing with remote access. So I think it really showed the value in healthcare organizations actually investing in technology and not treating technology kind of as a necessary evil.
Thank you. And Deb?
I would build on that. I agree totally. And I would say a step further is investing in innovative technology and understanding where healthcare or the world is going in the future is so important, so that you can be proactive and not reactive. So really thinking about a year from now, what's going to be the key focus, and already building that technology and having that available so that you're ready.
Super. And Ben, if you wouldn't mind taking us home.
Yeah, I think that for me, what we saw with the speed that a lot of this, the delivery around the pandemic happened, just showed me that anything is possible if you get everybody aligned and moving in the same direction all at the same time. And I think that's an important lesson for us as we move forward, whether it be through innovative technologies or something that is just going to that all of your peer organizations are already doing, but you need to do it. You can figure out how to get everybody aligned and moving in the same direction. Anything's possible.
All right. Well, I want to thank all of our panelists. This has been a super discussion. You all provided great information. I want to thank everyone that joined us for the Healthcare Technology Executive Perspectives. I'm Troy Ament with Fortinet. You can reach us at healthcare@fortinet.com, or you can reach us at fortinet.com/healthcare. Thank you very much.
And that is all the time we have for today. I want to thank Troy and our panelists for an excellent presentation, and Fortinet for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out our post-webinar survey. Thank you for joining us, and we hope you have a wonderful day.